When we think of medicine, we think of white coats, hospitals, high-tech tools. But what if I told you that over 3,000 years ago, ancient Egyptians were already treating infections, performing surgery, and even diagnosing diseases with stunning accuracy? Their tools were copper scalpels, their prescriptions, honey, mold, and herbs, and their medical knowledge, centuries ahead of its time. Egyptian medicine wasn't based on magic alone. It was practical, experimental, and in many ways, scientific. The Edwin Smith Papyrus, written around 1600 BCE, is the world's oldest surgical textbook. It describes how to examine wounds, diagnose head trauma, and even set bones using splints. The Ebers Papyrus contains over 700 remedies. They treated toothaches with crushed onion and cumin, eye infections with copper salts, and wounds with honey, which we now know has antibacterial properties. Egyptian doctors understood that the body had channels, a concept similar to blood vessels or energy flow. They believed illness came when these channels were blocked and used purging or enemas to restore balance. Surprisingly, some of their techniques were backed by modern science. Moldy bread applied to wounds, that's natural penicillin. Poppy seed extracts, that's early pain relief, similar to morphine. Trepanation, the removal of skull fragments, was done safely in some cases. And yes, they had specialized doctors, dentists, ophthalmologists, even proctologists. One inscription literally describes a shepherd of the anus. While religion played a role, Egyptian medicine wasn't blind faith. They observed, they documented, they passed knowledge from one generation to the next. In fact, Greek doctors like Hippocrates and Galen studied in Egypt. What we now call Western medicine started in the Nile Valley. So the next time you hear that ancient civilizations were primitive, remember this: Egypt was diagnosing illness before some cultures even had a written language.